Hi class, my name is Nora and this is my video submission for week 5 of Health Informatics, Form 5, Art of Caring in Technology-Laden Environments. I'm going to read off the first question, give my response, and then go through the next following questions. The first one is, do you feel technology creates a barrier between patients and family members and the nurse or administrator? If so, what strategies could be used to reduce the barrier? Yes, I think first I want to say that technology is amazing. It's super beneficial, especially for nurses and administrators. It's easy to access information, manage it, and get in contact with patients. An example of this would be a patient portal. This is super beneficial. However, I think of the elderly community, for people that are older, maybe 60s, 70s, or even people that are 80, they are not as familiar with electronic devices and software, so this might give them a sense of not as much of a personal touch. I also think that there's a loss of face-to-face interactions. So for example, an example of this would be a telehealth service. Those are super beneficial and some people love them. However, if there's not another option for them, or if a doctor or nurse wants to use that instead of actually meeting with a patient, I think that, just being on a Zoom call or some digital platform isn't as caring as being in person. Some strategies to reduce the barrier are, when you are in person, and whether you're a nurse or administrator, when you're in person with a patient, make sure that you are giving them eye contact, make sure that you're asking thorough questions and not just staring at a computer the entire time, writing down their information. The second question is, discuss your thoughts on nurses and administrators engaging in self-awareness and caring consciousness, especially in today's digital age. Do you feel it is possible and realistic to expect nurses and administrators to engage in these things when caring and interacting with patients? Why or why not? Yes, I think it is possible and realistic for that to be done. I think it is to a certain extent. For example, nurses, if they are burnt out, they're not going to be able to be as caring and as focused when they're with a patient. So it's important for nurses and administrators to be aware of their own mental health, emotional health, spiritual health, how they are doing, and so making sure that they're okay so that they can give proper care to patients, because when you are at work, you are focusing on the patient. That is the number one priority, not yourself. So you need to be in a place to be able to care for them. And then self-awareness is incredibly important. Even for people who aren't nurses and administrators, I think that everyone needs to be self-aware in their job and their career. I think this relates to nurses. I think it's important for them to be aware of how they are communicating with patients, giving them eye contact, asking thorough questions, even being careful to your word choice and making sure that your tone comes across appropriately, because patients might feel dismissed or not cared for properly if you're not communicating with them in an appropriate manner. The third question is, the chapter also discusses the Caritas processes. The ninth process goes over the alignment of mind, body, spirit, wholeness, and unity of being in all aspects of care. And then this goes with the question, do you feel it is appropriate for a nurse and administrator to discuss alignment of mind, body, and spirit with patients they care for and are responsible for? Why is this important? Yes, I think it is appropriate, but it has to be done in a specific manner. This kind of goes in with the next question. How would you handle a situation where you are caring for a patient that has religious beliefs that you disagree with? No matter what they believe, the kind of patient you're dealing with, you want to respect them, even if you don't agree with it, because the Bible calls us to love first. Love doesn't mean support, so we don't have to agree with it, but we do want to respect them because they are in our care and our focus is on them, their needs, and their health problems, and making sure that they're taken care of. So it's important just because you don't want a patient to come in and have a bad experience or feel like you're not listening to them, or that you are making them feel judged. That could lead them to feel uncomfortable if you are telling them that you disagree with them. But I do think it is important to discuss mind, body, and spirit with patients. It just needs to be done in an appropriate manner. We are called to spread our faith, so I think that's very important. But we don't want to force it or impose it upon anyone and make them uncomfortable, because doing that would actually just push them further away, and that is not what we want. Um, how would you handle a situation where you are caring for a patient that has, oh, I just went over that. I think that for me, if I'm caring for, I'm not a nurse, but as an administrator, if I'm caring for someone who doesn't believe the same things I do, I'm still going to give them the exact same care that I would for anyone else. I'm going to make sure that I'm doing my best and that I'm still being respectful, even if they have a lifestyle that I do not agree with or that I do not think is okay. I am still going to make sure that they are taken care of and make sure their needs are met. Overall, I think that these topics are very important for nurses and administrators to be aware of in their fields. Especially, I want to emphasize self-awareness and caring consciousness. Those two things are very, very important, especially for nurses, because they're dealing with so many patients in their day-to-day interactions. Even one day, they're dealing with so many people. And so those things really make things better for the nurse and better for the patient.